As millions of Americans slip into unemployment and lose their health insurance during a public health crisis, Senate Republicans still see no need to act on health care. More than 36 million people have filed for unemployment benefits due to the economic fallout from the coronavirus pandemic, meaning millions will be left without health insurance. In mid-May, left-leaning think tank Economic Policy Institute estimated 16.2 million people have lost health insurance once provided by their employer. How roughly half of Americans get their health insurance. That number could be as high as 26.8 million if those who lost their jobs don't sign up for other coverage, the Kaiser Family Foundation found. But the Republican majority in the Senate isn't interested in pursuing additional emergency relief for those who suddenly find themselves uninsured. I'd like us to put in place a better program than the one we have, the Obamacare program, but getting that in place for the country to take advantage of in the next few weeks is just not very likely, Senator Mitt Romney, R. Utah, said. Staff for Susan Collins referred HuffPost to previous comments the Maine senator made to Bangor Daily News that she was disappointed in President Donald Trump for not allowing a special enrollment period for the Affordable Care Act, but did not comment on Congress taking further action on health care specifically. I think that the enrollment period should have been reopened, Collins said in the interview. One of the reasons that I push the Paycheck Protection Program so hard is that if we can keep people on their regular payroll, many more people will continue to receive their health insurance. The Paycheck Protection Program gives employers loans primarily to keep workers on payroll during the pandemic. Collins is part of a bipartisan push advocating an extension of these loans. Senator Lamar Alexander's office declined to comment on what Congress should do on health care, saying they had nothing to add at this time. The Tennessee Republican is the chairman of the Health, Education, Labor, and Pensions Committee in the Senate. Offices for Sens. Bill Cassidy, Tim Scott, SC, Lisa Murkowski, Alaska, Mike Braun, Indiana, and Rob Portman, Ohio, who sit on either the Help Committee or the Senate Finance Committee, which collectively have purview over Obamacare, Medicaid and Medicare, did not respond to requests for comment. Senator John Cornyn, R. Texas, who has repeatedly voted to repeal the ACA, encouraged Americans to sign up for Obamacare if they lose their health insurance. The good news is that if you lose your employer-provided coverage, which covers about 180 million Americans, that is a significant life event, which makes you then eligible to sign up for the Affordable Care Act, Cornyn said in a PBS Austin interview. As you know, it has a sliding scale of subsidies up to 400% of poverty. So that's an option for people. To get covered, Americans will have to navigate the country's fragmented health care system. There's the ACA, known as Obamacare, public options like Medicaid, and COBRA, the federal program that lets individuals continue their former employer's health care plan at personal cost. As HuffPost's Jeffrey Young explained, there are barriers to all these options. The Kaiser Family Foundation estimates there are 5.7 million people who are not eligible for financial subsidies under Obamacare, and who would have to pay for the entirety of their private insurance plan. COBRA too is cost prohibitive for many families. The average monthly cost for individual coverage in an employer-sponsored plan is $490, amounting to nearly $6,000 a year, a steep cost for someone without an income. And not all Americans will qualify for Medicaid, the public health program for low-income Americans. Unlike in past recessions, most of those who lose their job-based coverage will be eligible for health coverage because of the Affordable Care Act, though some may find coverage unaffordable even with subsidies, Larry Levitt, who runs health policy at KFF, said in a statement. As unemployment benefits expire, however, about 2 million more people in states that did not expand their Medicaid programs under the ACA will move into the Medicaid coverage gap and have no affordable option. The implication of leaving millions uninsured is a matter of life and death. A 2019 report on Medicaid expansion found there could have been 15,600 fewer deaths if all 50 states expanded Medicaid under the Affordable Care Act. There's a growing body of research that has shown expanded public insurance has improved health outcomes, increasing preventative care and saving patients with chronic illnesses, like kidney disease. To be sure, it's hard to make a clear comparison between Medicaid expansion and growing numbers of uninsured, especially because healthcare providers have only recently begun loosening restrictions around preventative care checkups and other services that were deemed non-essential during the early weeks of the pandemic. From HuffPost.